I'm a urologist down the hall at Central Maryland Urology Associates. I know most of you, or at least many of you, are part of the group. And I see some familiar faces. I think by the fact that so many of you are here and sort of braved the wind and braved the cold speaks to the heart that people are really searching for something more. Know the treatment options out there, surgery and radiation are sort of the traditional treatments, and want something a little more, want some better results, less side effects. And I think HIFU has that potential. Still young, but I think some exciting results. So tonight we're going to talk about HIFU. The title of the presentation is High Intensity Focused Ultrasound, a minimally invasive way to treat prostate cancer. This is a very informal talk, so please feel free anytime to interrupt me, raise your hand, shout, throw something at me, do whatever you can to get my attention. A little bit about, but just first of all, again, the sign-in sheet is there. There's a questionnaire as well to help us get better at this, so if you have any suggestions, what we did well, what we did, what you'd like to see, please feel free to share. A little bit about myself. I finished my urologic training at the George Washington University Medical Center in Washington, D.C., all the way back in the spring of 2009. Shortly thereafter, I joined the group here. There's 8 of us all together now down the hall. And this past year, I started the Central Maryland Urology Associates HIFU Center. And the simple fact that I, too, was searching for something more. I think doctors ourselves, we're searching for some better results, something new, something that will have better results and less side effects than the current treatment. So the first thing we'll talk about today is go over some statistics of prostate cancer. They're sort of a segment of the medical community that feels that we're very aggressive with prostate cancer screening and prostate cancer treatment, maybe screen too much, treat too much, and for the most part there are some truths to that and there are some pluses and minuses to both sides of the argument, but we're going to share some statistics that sort of reiterate the fact that this is a very significant disease. Follow that, we're going to talk about some screening for prostate cancer, go over all the treatment options including HIFU, which is why you're here, talk about HIFU, what it is, go over some of the results. And we're lucky enough to have a patient here who has undergone HIFU, one of my patients, Mr. Messick, who is going to be talking at the end, share his experiences, sort of what he was thinking beforehand, during, after, if he would do it again or not. And I think it's a great way for you to ask me questions, ask him questions. There's only so many things I can answer, but I think it's a fantastic way for you to learn about from your side, from the patient side. And again, please ask questions. It's very boring for me to sit up here and talk all day, so if you have any questions, shout. According to the American Cancer Society this past year, almost 218,000 new cases of prostate cancer have been diagnosed. Over 32,000 men will die of the disease. If you take away skin-related cancers, it is actually the most common diagnosed cancer among American men. If you, in addition to that, it's the second leading cause of cancer-related death in the U.S. as well, second to lung cancer. And if you look at the left column here, prostate cancer, by far the most common diagnosed cancer, again taking away skin cancer, and the second leading cause of death. Now if you compare that to breast cancer, again, like I said, there's a lot of controversy regarding prostate cancer. There is some controversy regarding breast cancer screening, breast cancer treatments, but by far less than prostate cancer. But if you look at the numbers, there's actually equal amount of deaths of prostate cancer and breast cancer. So again, quite a significant disease. Overall, the bottom line, 1 in 6 men will be diagnosed with prostate cancer in their lifetime. Of those 1 person, 1 in 6 will die of the disease. The other 5 would live a normal, happy life, never even known they had it, but if it weren't for the screening. If we could, sort of the holy grail is, the problem is we don't know the 1 person that's going to die from the 5 that would live a normal, happy life. If we're working on that test, if it's genetic or other, we don't have that test yet. That's sort of the holy grail. What we use instead is as much information as we can, and that includes your PSA value, your biopsy results, your rectal exam evaluation, your age, your other medical problems, your family history, and we sort of combine that and basically make an educated guess or educated decision whether this person needs treatment or not. A couple important points. prostate cancer can be treated and it can be cured. Men diagnosed with prostate cancer can live a normal life. And as we talked about, most men will not die from the disease, but in fact will die with the disease. And that's important to remember. Okay? Most men, like we said, will die of something else, actually die of heart-related disease. So most men diagnosed with prostate cancer will actually die of heart-related disease. Now, how do we find prostate cancer? Most of the time these days it's from screening. And the screening consists of two things, one of which is the rectal exam, the other of which is the PSA blood test. If either one of those is abnormal, we go ahead and do a biopsy to determine if there's cancer or not. The PCA3, the PCA3 test was the question. The PCA3 test is a good test. It's a newer test. It's a test of the urine, and what we do basically is we perform a rectal exam, and following that you urinate for us. We collect that and send that off to determine if the PCA3 test is positive. There are some good results. It is still relatively new and may in fact at some point overtake the PSA. It hasn't quite gotten there yet. It's sort of used when everything else is equivocal and we're not sure whether we should do the biopsy or not. Then that's another adjuvant test we can say, okay, well let's try this. If it's positive, let's go ahead and biopsy or not. It's one way you can use it.
There was a blood test that the Hopkins was working on at one point that was supposedly more accurate than the PSA. What is that? There's a lot of research trying to find something better, and that again, that's the problem. We don't know, we can't determine which one person's going to die and the other that's not. We're working on that one test. There are a lot of tests that haven't been proven yet. They may have been proven in smaller studies that haven't really been widely accepted yet. Hopefully within the next 5 to 10 years, those tests will actually come out and be better than PSA, but right now, PSA is really the most accepted test that there is and the best that we have. So, as far as the digital rectal exam, hopefully this is not your urologist. If it is, you have problems. But the rectal exam, basically what we do is we insert a finger in the rectum and feel the prostate. We're looking for anything abnormal, any abnormal lumps or bumps, anything suggestive of prostate cancer. The T1 disease, basically, if you cannot feel anything but just find the prostate cancer by PSA, that's considered T1 disease. Everything above that, whether you can feel it or how far it extends throughout the prostate, increases your stage. I don't want to go into too much detail on it, but basically the digital rectal exam, we're feeling for the prostate, seeing if there's anything unusual. And again, there's really nothing to fear about the prostate. We should make these t-shirts up. The PSA blood test. The PSA is a simple blood test. It's a protein made exclusively by the prostate. It's specific for the prostate, but not specific for prostate cancer. Okay? So it could be elevated for other reasons besides prostate cancer. It could be elevated for prostate cancer, prostate enlargement, otherwise called BPH, prostate infection, otherwise prostatitis, prostate inflammation, prostate trauma. Just doing the prostate exam can actually elevate it, some people think, for a day or so. And then ejaculation can actually elevate the PSA level for 2 or 3 days. Now, an interesting fact about the aggressive nature that we've been going about screening for prostate cancer in this country. With the increased use of screening over the last 10 to 15 years, there's been an increased diagnosis of younger men being diagnosed with the disease. So instead of prior finding patients diagnosed at the age of 70 and 80 with prostate cancer, nowadays we're finding patients at the age of 60 and even 50 years old having diagnosed prostate cancer. And that's an important fact, and we'll get back to this in just a minute. So we do the biopsy, you're diagnosed with prostate cancer, now what? It can be devastating, it can be frightening, it can be overwhelming. There's so many choices, so many which ways to go, so many treatment options, it can be very overwhelming.